Madam Chair, I have Governor Rendell's being very kind and is offering me to take questions now because I'm going to try to catch a plane, and then if he's willing to suspend his comments, if that's okay with you, Madam
Thank
Chair.
you. Sure. No, without objection. Okay, let me address my first question, of course, to you, Governor. And I would like maybe if Governor Rendell wants to comment on this very first question. We all know that small businesses across the country are struggling with the rising cost of health care. And one of the main problems in many states is the lack of competition in the health insurance market. This was reiterated yesterday by the Nevada merger between United Health and Sierra that was approved by the Department of Justice. Governor Pawlenty, while I appreciate that Minnesota-based United Health employs many citizens of your state, I was hoping that you can talk about whether this increase in consolidation concerns or presents any concerns about competition.
Well, I'll give you one other, Madam Chair, thank you, and members. United Health is a large company located in Minnesota, but oddly, it's not allowed to do business in Minnesota. We have an old law in Minnesota that prohibits for-profit health companies from providing health services in our state. I think we're the only state in the nation that does that. So what we have is 3 nonprofit providers, 3 health plans that control 85% of the market. In the early 90s, we did a reform where we were going to try to, we were the first in and heaviest in the HMO. I wasn't there then, but that's what we tried to do. And what happened is initially there was some progress as to cost containment. They took the low-hanging fruit. But I would suggest to you that in Minnesota, our market is not robust from a competitive standpoint. We have 3 nonprofits that compete. What they do from year to year is cannibalize each other's market share. So one comes in as the low-cost provider one year for these big employee groups. They get selected. The losers come back and underbid them next year. And so they just trade relative market share from year to year. The quality of services and offerings don't vary significantly other than on marketing labels, and we could stand for much more robust competition in my state. I think the semi-monopolization of our healthcare market in Minnesota and the vertical integration of it has not served us well. Now, that's not a comment about what's going on in other states or United. It's a comment about the fact that we've allowed and encouraged in some ways through public policy the vertical integration of the healthcare delivery system in Minnesota, and it's not served us well.
Okay, thank you. And let me go, Governor.
I want to add very quickly on that. Ironically, we're trying to get United to come into Pennsylvania to spread competition. But there are things you can do. The reason that there is no competition is when you have 2 or 3 or 1 dominant carrier in an area, they're allowed to negotiate with hospitals and doctors clauses that make it impossible for competition to come in. And I would recommend that Congress take a look at those type of clauses, sort of the most favored nation clauses, and outlaw them. Plain and simply outlaw them. Make it impossible for them to negotiate those, because providers, a hospital, if you're 80% of the market, you're the HMO, and you want that type of clause, the hospital's in deep trouble if they don't do that. So they're forced to take an abusive regulation that stifles competition. That's something I urge you to take a look at, and something I think you could legislate.
Thank you. Governor Pawlenty, we have been here in this committee and throughout the Congress trying to enact legislation that will allow for small businesses to be able to purchase health coverage. And one of the bills that we passed was the creation of the association health plans. I supported that legislation, which will allow for small firms to pull together for purchasing health insurance. And despite passage of the bill in the House numerous times, wide support from the small business community and the backing of Minority Leader Boehner and the President, the proposal was unable to get through the Senate. And during the debate, some states expressed concerns about allowing firms to buy coverage across state lines, and the National Governors Association actively opposed HAPs. As a governor, do you have reservations about allowing small businesses to band together if the plans were regulated by the federal government as opposed to the state?
Madam Chair and members, I would even take it one step further and say, first and foremost, we need to make sure that consumer protections are in place. These policies and rules and regulations are complex, and to have typical consumers try to sort through that without some guardrails and protections in place is something that we need to be very careful about. Assuming that those are in place at a state level or a federal level, in the world of the Internet, in the world of the iPod, in the world of global markets, in the world where regional and state boundaries are, melding, why is it that in Minnesota I can't buy a California insurance plan? Or why is it that I can't bind together with similarly situated people? Now, I'm speaking for myself now, not NGA, but it seems outdated and parochial to limit these offerings to the state that you happen to live in when this is largely a transaction involving the exchange of data and the exchange of information. And so my personal view, not the NGA's view, is that association health plans and assuming consumer protections, robust consumer protections are in place, people should be able to buy insurance wherever they want and in whatever form they want. It's a free country, and you shouldn't be bound by your own state's boundaries in that regard.
Thank you.
I would differ just slightly. I certainly agree with the sentiments Governor Pawlenty offered. But one of the things I'm fighting for, and in my testimony I'll mention it, is for the state insurance commissioner to get the right to regulate health insurance rates. He regulates car insurance, homeowners insurance, but doesn't regulate health insurance. And if we get that right, and I think that's very important consumer protection, so no one can be denied coverage because they have a prior existing condition, which is a yeast infection, for example. We need the insurance commissioner to have that right. How does our insurance commissioner regulate a product that's being offered in California? But if you go to, and I believe Congress should, some form of national health insurance, maybe a form that relies on a working arrangement with the states, but if you go to that, then I think it makes sense.